Hey everyone, I'm Dr. Wynn with Chiropractic, and in today's video I want to cover what is a disc injury and how we at Chiropractic can actually help you by first diagnosing, finding the problem, and then having a treatment plan catered just for you and to solving this disc injury. But first of all, what is a disc? Now a disc is this red part right here. We have the spine, and so you have the vertebrae that sits right here and here. In between each vertebrae has the disc. Now the disc is more soft, more squishy, filled with fluid. And then you have the nerves that go from all the way to the brain, down the spinal cord, into the rest of the body. A disc injury happens whenever there's something protruding out of this disc space. For example, a car accident or even everyday wear and tear can cause something like this disc injury. So something happens, puts a lot of pressure on the bone on your spine, can pop out just like that. That's what we call a disc herniation. If you can see that again, that can pinch onto the nerve. And with that, it can cause something called sciatica. Sciatica is when you have a pinched nerve in that sciatic nerve going down your leg. You can get sharp shooting pain, you can get numbness, you can get tingling, you can get all the above down to your toes. If that's something that sounds like it has happened to you, it could be from a disc injury. And so whenever that disc ruptures, we call that a herniation, where it escapes the sac that's holding it together. When we have a disc bulge, it hasn't quite escaped yet, but it can definitely put pressure on these structures, including your nerves. So how do we treat that at Core Chiropractic? First, you'll get a full evaluation with tests, orthopedic tests, in order to find out more about you during the exam. Right after that, we'll do a x-ray for you. That way we're able to see how your spine is aligned and how these bones look side by side, front and back, so we can see if that herniation or that disc bulge or that disc is being compressed on the x-ray imaging. Not only do we do that, but we make sure we have the lines to show you the following day to see exactly how much it's gone into that space and how we can ultimately fix that. And so we do imaging, we do a thorough exam and consultation, and then if you're able to get an adjustment, we have that during our plan. So during our plan, we have adjustments that help align things better, take pressure off of that nervous system, and we have a machine called decompression therapy. And I'm about to show you that right now. This is our decompression therapy, where it's a very comfortable decompression traction device where, let's say you had a disc herniation or a disc bulge in your lower back. Something's putting pressure on that disc. So we want to decompress that area. Give those spaces room to breathe. So we'll basically have you sit on this chair. It'll recline backwards. We'll strap you down first under your armpits for your lower back, and then strap you down right here. And it gently decompresses your spine, allowing that space to slowly open up, therefore taking pressure from the disc off of your nerves. And those symptoms like that numbness, tingling, sharp shooting, or just pain in general, hopefully can alleviate with more decompression therapies and adjustments. Now, if that sounds like it can help you, please make an appointment or call in to ask more questions. If you have a disc injury, we want to take a look at it before we do anything like treat it, but we are here to help with disc injuries and we see them every single day. If you have any questions, if this video helped you, please leave a like, comment, subscribe if you like to get to know more information. Again, I'm Dr. Wynn with Core Chiropractic. Hope to see you soon.